Access to the healthcare system with quality and equity is what every country in the world desires. The ideas and actions towards the collaboration among children, youths, adults, and relevant agencies in Thailand are the lessons for the world citizens from various communities, societies, or countries to learn from and share with one another, which will lead to the people's equitable physical and mental health status in their own context. High-tech, high-cost services. How to manage to get equitable access. Nonthaburi Province. As a result of the changes in Thailand's economic and social structure, along with the global trends over the past several decades, Thai people's consumption and healthcare behaviors have changed accordingly, resulting in the increase in the prevalence of non-communicable diseases, or NCDs, some with a high treatment cost, particularly cardiovascular diseases. The Central Chest Institute of Thailand, Department of Medical Services, Ministry of Public Health, is the place where specialty care for heart and lung diseases is provided. At present, the chances of Thais to be suffering from cardiovascular diseases have risen threefold, particularly from acute coronary syndrome, which is a high-cost illness requiring specialized medical treatment, including quality medications, sophisticated technologies, and advanced medical skills. Dr. Kurengrai Hengrasamy, Senior Medical Expert and Head of Cardiology Group of the Central Chest Institute of Thailand said, normally there are two major groups of patients attending the cardiology clinic, acute and chronic patients, under all kinds of health insurance coverage. Most of the patients come with coronary artery disease, and about 200 to 300 cases are treated with the balloon angioplasty and stent placement through the fast track for STEMI patients of the Institute. The procedures are satisfactory in 98% of the treated patients. About half or 50% of all the patients are covered by the government Universal Healthcare Scheme. In Thailand, the entitlements to medical are available under several health insurance schemes, and the one for the general public is the Universal Healthcare Coverage, as prescribed in the Constitution, under which expenses for high-cost medical treatment are covered. Dr. Vinay Sawaddiwan, Secretary General, National Health Security Office, or NHSO, said, before the launch of the Universal Healthcare Scheme, high-cost medical conditions requiring specialized care were problems of and inaccessible to the general public. As such, medical services were not covered by the government and untimely. Now, in providing universal health services, it is important to specify the benefit packages that cover all dimensions of medical care, including quality, accessibility, coverage of high-cost services, and prevention of catastrophic health spending. Here, the fast-track system has been established for patients with acute myocardial infarction or heart attack, or STEMI, in line with the international standards. The system's aim is to provide efficient and timely medical care by a health team that comprises medical doctors, medical assistants, cardiac catheterization lab nurses, and intensive cardiac care nurses. And importantly, there is an efficient referral system for patients in the upper central region of the country. All health team members have been working together in developing medical treatment procedures and patient care networks for patients with cardiovascular diseases for the country. This has resulted in declines in the mortality rate of emergency room patients and in the complication rate. Nampung Thong Prasom, a female patient with heart disease who had been unaware of her illness before, was urgently transferred from a hospital in the cardiac care network for balloon angioplasty. Nam Pung, the heart disease patient, said, "I never knew that I had had the illness. It attacked me silently. My family is never rich. The 30 baht or universal health care scheme has helped me. It is like being reborn. Without such emergency medical care, I would have been in trouble. At a later date, I learned that the medical expenses were very high. If I had not been eligible for the universal coverage, I would not have known what to do. I am very happy with the system." Dr. Kriengrai Hengrasamy said, "We use the patient-centered care approach for the maximum benefits of the patients, even though the institute is unable to get fully reimbursed for the medical cost incurred. The aim is to help the patients to survive and go home with better quality of life, no matter whether they are acutely or chronically ill. Regarding the medical expenses, we have got a financial clearing system designed in accordance with the patient's health insurance schemes and the Institute's financial management system for the Institute to be financially viable." Not far away from the Central Chest Institute, there is a case study conducted on palliative care for patients with end-stage kidney failure under the Universal Healthcare Scheme. At present, the number of kidney failure patients is on the rise. So are the incidence rates of non-communicable diseases among the Thai people. The Universal Scheme now also covers the expenses for kidney transplantation, hemodialysis, and peritoneal dialysis. This is Pranang Klao Hospital, the provincial hospital in Nonthaburi Province. It is a representative of the Thai medical care system for kidney disease patients. At the moment, a doctor is giving advice to a mother with kidney disease and her daughter/caregiver on a suitable dialysis method, either hemodialysis or peritoneal dialysis, taking into account the cost, time, place preparation, caregivers' irregular work hours, and small family size with a low income. Every day at the dialysis center, the kidney healthcare team, comprising skilled doctors and nurses, has to encounter the rising number of patients beyond the team's service capacity. The team has noted that it seems insufficient to just giving medical treatment, but other actions have to be undertaken, also including giving knowledge about the cause, treatment, and prevention of the disease, as well as learning about the patient's personal and family conditions. At the dialysis center, the advice given is on health insurance eligibility, pros and cons of the types of dialysis, suitable dialysis method for each patient, treatment costs, and convenience in receiving the service. The patients and relatives are taught to carry out each step of the dialysis procedure. Today, the teaching and training focuses on peritoneal dialysis so that they are skillful in such a procedure. This patient has chosen this procedure after having considered various factors such as transportation, time, and expenses, compared with the hospital-based hemodialysis, as some patients live very far away from the hospital. Patient's relative said, "We have chosen this method because all the cost is covered by the universal healthcare system, while another method's cost is not fully covered. And my mother, who is the patient, also suffers from heart disease. We realize that dialysis is risky, so the place for dialysis at home has to be properly arranged and cleaned. That is not beyond our capacity. The doctor and nurse have taught us all the steps. Now we can do it by ourselves. We have been taught to observe the patient's symptoms. If there is an infection, the patient has to urgently brought to see the doctor. it is lucky for the patients to receive the government support, especially for poor, lower-class people. Dr. Vichai Sopasatit, head of the Continuous Ambulatory Peritoneal Dialysis (CAPD) Clinic, Pranang Klao Hospital. For this high-cost illness, we have cooperated with the National Health Security Office in setting up a system and training medical personnel. The system is strong to a certain extent. Many steps have been developed to coordinate the patient care, as the network node, Pranang Klao Hospital, works together with its network members at the district, sub-district, and village or community levels. In paying closer attention to patient care, we focus on giving knowledge about disease prevention to the people as an upstream action and providing medical treatment as a downstream action. To decrease the overcrowding at the provincial hospital, more nurses and other health team members have been trained in the care for kidney disease and assigned to supervise and support home health care for kidney patients, which is essential and necessary. At this Tambon or sub-district health promoting hospital, the nurse and other health workers from Sai Noi Hospital, a community or district hospital that is a kidney care network member under Pranang Klao Hospital's kidney care system, are getting prepared to make home visits to kidney patients in their designated area. The follow-up visits are carried out in accordance with the operating procedures established by the provincial hospital for all community hospitals and Tambon health promoting hospitals in its network. This old female patient chose to undergo peritoneal dialysis, and after having had the dialysis procedure performed at Pranang Klao Hospital, she returned home and continues to receive home health care. The kidney care setting at home has been prepared and arranged by her relatives, who have been trained in home health care for this kind of patients. This home visit is an essential part of Thailand's medical care system for kidney disease patients. If they find any abnormality, a report on such an incident will be sent to Pranang Klao Hospital so as to revise the treatment protocol. Importantly, the visit is regarded as a morale-boosting effort for the patient, and it is an important aim of Thai health personnel towards improving the health system for the Thai people. A nurse at Sai Noi Hospital said, "Making home visits helps us to see the real home care setting, the environment, and living conditions of the patients. We can also give them some assistance or advice." Dr. Vinay said, "Thailand is regarded as an example or role model in having achieved its universal healthcare goal. While the country's per capita income is less than $2,000, it has made other low-income countries have some hopes, which means that they don't have to be high-income countries. They can do it."